Good afternoon, everyone. I hope you're having a great day wherever you are. Thanks for joining us. As Franz said, let's see if I can click this slide forward. My name is Heather. I have been with Phelps Health since 2005. My background is rooted in social work, and I'm a certified case manager. I have worked on every acute unit and post-acute unit here at Phelps Health, covering case management. And since 2017, I have been with our quality team working on becoming a certified improvement coach. As of yesterday, I do have my Lean Six Sigma Green Belt and completed my coursework for Masters of Organizational Leadership, so that's exciting as well. I understand everything you're going through with school, so hopefully you're getting through it and you're improving by the day. So I'm honored and grateful for this opportunity to speak with you today about patient coaching. This will just basically be a brief introduction, what it is, what it isn't, and I want to provide you with some tools to enhance coaching practice if this in fact interests you and you want to study further after today. So thank you, Franz, for inviting me to this space.
Can you minimize that window?
Sure.
It'll show up in the video.
Okay. I'm going to minimize this. Okay. So just talking about our objectives for today. When you are done with this presentation today, I want you to be able to define the art of coaching within the healthcare realm. I want you to be able to differentiate between your role as a clinician and a health and wellness coach. And then I want you to be able to identify techniques or skills to build on to create an effective patient partnership for coaching and change management. So let's talk about what coaching is and what it isn't. We've all had a coach at some point in our life, whether that's our parent, our guardian, a teacher, a mentor, or a sports coach. And they partner with us to improve an area that we identify, or maybe we don't identify personally, that we need to or want to improve. It is a collaborative relationship between two people. There's always a giver of the coaching and a receiver. And the giver works to uncover the goals and the receiver works towards them. And then each party understands increasingly the potential and capacity of the receiver. In 2013, Woollever and colleagues reviewed over 800 abstracts with the inclusion of 284 full text articles, and based on their literature review, they came to this definition for health and wellness coaching, that it's a patient-centered approach wherein patients at least partially determine their goals, use self-discovery or active learning processes together with content education to work towards their goals and self-monitor behaviors to increase accountability, all within the context of an interpersonal relationship with a coach. That's a long sentence, but very true. And what's interesting but not distinctly mentioned in this definition is the implication of the interpersonal relationship. This implies that there's a consistent, ongoing relationship between the client and the coach that is trained in behavioral change, communication, and motivational skills. So down to the differentiation, what a coach is not. A health and wellness coach does not necessarily diagnose, interpret behaviors or beliefs, or clinically advise patients of what to do. Now, in saying that, a coach can have more than one role. You may have a role as a physician, but then take on a role as a coach in different portions. And it's important to know the skills that will differentiate you from your clinical diagnosis physician hat to your coaching and behavioral change hat. The reasoning, the clinician has the ultimate picture of what the ultimate goal is for the patient, but the patient may not be there yet. So what the coach does is they use these evidence-based learning techniques to elicit personal responses around meaningful goals that assist the patient to generate solutions to their personal problems. Okay? This is helps us to understand the relationship, helps us to understand the patient's capacity for small steps towards that bigger picture that you as a clinician have in your mind that you want your patient to reach. So who participates in this? Well, everyone that touches the patient has an opportunity to coach them, but not everyone has the skills needed to support that role. It can be multidisciplinary. Dietitians, nursing, physicians, social workers, all of these roles can take on a coaching role. Certifications are available, and I did check out these sources. One of my favorites is the Mayo Clinic. Unfortunately, it's waitlisted through 2021 at this point, but keep your eye on that if this does interest you. Many clinics are moving towards a model where the coach is present as a separate role within the primary care clinic to help our patients that have multiple morbidities or problems. So why health and wellness coaching? Why is this making such a comeback right now? Well, the World Health Organization reports that 10 to 25% of hospital and nursing home admissions result from patient non-compliance. They report that 50% of prescriptions filled for chronic diseases in developed countries are not taken correctly, and that 40% of patients do not adhere to their treatment regimens. So when I put this up here, I also noted that 75% of people over the age of 65 are living with multiple chronic conditions. So that creates complexity. And so I want you to challenge you to think about this word non-compliance. Think about where and when you've heard the word in your clinical settings, in your practices. And when you've heard that term, do you believe that it's true? Or could there be a world where medical and clinical semantics collide with the patient's understanding or their capability to understand and make personal changes? So health and wellness coaching really starts at the health literacy level. We know that 36% of all adults have low health literacy, according to the Center for Healthcare Strategies. And health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services. And when I say basic, we're talking about understanding our insurance, understanding that we have an appointment, where to go, basic questions about asking for medications, understanding why you're getting a test. 36% do not have the capacity to process that information. In Missouri, the cost of low health literacy to our economy in 2008 was anywhere between $3.3 billion and $7.5 billion annually. That is a large effect on our economy. So understanding and beginning with understanding your client's health literacy level is very important. When you combine low health literacy level, multiple morbidities, and none or minimal advocacy, it doesn't necessarily create non-compliance. It creates incapacity for change. We have a larger picture as clinicians, and when we place that larger picture expectation on that patient, they may not be able to handle that. This is where the coach comes in and is best suited to enter the scene. This is one of my favorite quotes from Craig Rochelle, leadership guru. You might have heard of him. It says, people don't hate change, they hate the way we try to change them. And that's because we're not great at meeting the patient or the person on their level. And so that makes, when we don't meet them on their level, it makes an incapable situation. When the patient takes that multiple comorbidity, multiple medication, multiple specialists situation, and they combine that with whatever they have going on in the outside world. It could be anxiety over how they're going to meet what I like to call the three walls, their shelter, food, utilities. It could be other things going on that we have no clue about. Self-care and management get pushed this side. And so my stance is that we don't necessarily are talking about non-compliance. Again, we're talking about incapacity. So capacity can take on a few dimensions. It could be the capacity to learn and understand, or the capacity to provide and meet needs. So it's important that whenever you practice as a coach, you know the culture around you. If you are in our culture here in Rolla, Missouri, you understand that 20 miles down the highway, we have a major military base. We are surrounded by thousands of veterans each day. So understanding the patient from a veteran perspective and the exposure or the diagnosis of PTSD that they may have, and how that affects decision-making, how they process information, that's very important. So knowing that culture is very important. And these things we don't always discuss as clinicians, do we? But as coaches, we have the opportunity and chance to dig in and assist the patient to understand these things, understand what they're going through, and promote self-management. Health and wellness coaches utilize techniques to assist the patient in determining what they can handle in the here and now, and how they can build habitual practices of self-care for the future. So what does it take? So we know we need a holistic assessment, and we know that clinicians and physicians don't always have the time for that at the bedside. But holistic assessments and understanding everything from social support, physical abilities, capacity to care for those three walls are very important. Utilizing humble inquiry takes a lot of patience and understanding. We'll get into that in a little bit, but it is also very important. Empathetic listening is another tool, listening to understand and not listening to simply respond to the patient. We utilize SMART goals. We can utilize evidence-based handouts that you're gonna get resources for, or you may have already, like Talking with Your Doctor handout, med record sheets, and the like. Humble inquiry. Dr. Edgar Schein has formalized this practice, and he says that humble inquiry is the fine art of drawing someone out, of asking questions to which you do not already know the answer, and of building a relationship based on curiosity and interest in the other person. Our patients are overrun with repetitive questions that are probably already in the medical record. Humble and appreciative inquiry lets go of assumptions and judgments, and coaching utilizes that to get down to the ability of the patient to resource. Does your patient have the ability to resource for their needs? It takes, like I said, practice and patience and a willingness to understand your patient. So in 2020, what does that look like? Here's some questions in 2020 that you may ask the person next to you even. And I know this is hard. We're really great at small talk. And these are some deeper rooted questions. But what can you do just for you this week is another important question. Again, the goal is to listen, to understand, and not to respond. Some of you, I understand, are going to participate in a project where you're going to interview a patient and create a medication list. Some questions I always like to ask around medications are, do you know why you are taking this medication? Do you prefer to use a med planner, or do you take pills straight out of the bottle? I noticed that you're on a blank number of medications. How do you feel when you open up the medicine cabinet and you see that number of pill bottles? And if they have a med planner, I always ask, who's filling that med planner? Because as you get to know their medical record and you compare their answers, you can determine their capacity and how you can help them get to a new place. You may have the clinical knowledge to know and understand the long-term goal, but our patients don't always have that capacity. Coaching utilizing humble inquiry, evidence-based tools such as medication doc sheets, the SMART goal worksheets will make small, doable goals clear to your patient. So here's some additional resources. The book I talked about, Humble Inquiry and Motivational Interviewing, are very great books to read and resource from. Also, we know the Agency for Health and Research Quality, as well as the National Institute for Health and the Institute for Healthcare Improvement, have multiple evidence-based tools to help you and help a patient work through what they have and what they are capable of. This is a SMART goal worksheet. These are available on different various media websites. I think this one came off of Pinterest, but you can grab those and capture those to work with your patient. So the main goal of that coach is to continue to perpetuate capacity. And how do we do this? Well, we want to partner with our patient. So not just a coach, you are their partner. You want to celebrate big and small wins. This is the only way you're going to promote their belief in themselves, to win the transition to habitual practice to improve their health care. Any questions? And I'm going to put my resources up on the screen as well. Do we have any questions?